Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. Tim, how are you?
I am doing quite well. And you?
Peachy. Nice to meet you by Zoom.
Yeah. I haven't seen you since we were out at Soldier Field together.
Oh, yeah. That's right. Journey.
Yeah, Journey's Dream.
Journey's Dream. Yes. Oh, wow. How have you been?
I'm doing quite well. My first question will be just to ask you to tell us a little bit about how you got involved in this. What was the start of your career and how it got into Orthomolecular?
That's a loaded question, and I'll try to make it very brief. I'm the biggest skeptic you'll ever meet. I didn't believe in any of this. I was a traditional family practice medicine physician. My specialty involved everything from pediatrics to obstetrics to gynecology to internal medicine. As we would say, from the womb to the tomb. That's kind of what we did. Always required hardcore evidence. I fell into this, Dr. Tim. I was not looking for it. My business partner, Dr. Judith Bowman, became rather disgusted by the use of traditional medication in children who were 3 and 4 years of age at 4 times the adult dosage for disorders like childhood bipolar, schizophrenia, behavior disorders, things like that. She found herself at an institution at the time, the original Pfeiffer Treatment Center. She was amazed by what happened there. And within a month's time of her starting, she actually called me to come and see this. I was totally skeptical. I didn't believe in this so-called nutrient therapy thing that we were told in our first week of med school simply did not work. But as an open-minded person, I decided, well, I would go there. And being an ace neuroscience student in med school, I figured, well, I would, in the worst case scenario, I would grace these people with my brilliance. All right. Well, Dr. Tim, visiting for just a few hours, my ego shrunk down to the size of smaller than a pinhead. Okay. That's an ego that could barely fit through the door at the time on entering. But what I saw was so cutting edge and so unbelievable, I was perplexed. And I said I had to either take a look at this field and take it seriously or miss out on the boat totally. It didn't help, by the way, that at 5-10 minutes after I left, I got a call from them wanting to offer me a job. And I said, wait, I didn't come there for an interview. I wasn't interviewing. And they said, no, we like you. We want to talk to you. So that's how it all began. I took a chance. I wasn't a believer. I wasn't somebody in search of, I wasn't the great Carl Pfeiffer. I was not that guy. I was simply a very skeptical practitioner of medicine. And it's actually because of that I do what I do now, which is I spread the word as much as I can, because I was that skeptical person and people need to know differently. That's how it all began.
Powerful. It's a very common experience for people that I've interviewed in these fields that I would term holistic mental health and holistic physical health. So how do you explain to people what orthomolecular medicine is?
That's one of my favorite parts, because I try to tell people this is the part of medicine that we've left behind, the part that was there 50 to 100 years ago. And I go back and I say, this is comprehensive medicine. At a certain point in time, Dr. Lister of Listerine fame, he basically talked about bacteria. And we began to worry about the outside invaders, viruses coming into the system, bacteria coming into our bodies from the outside environment. And we began to turn medicine outward. That's when we developed antibiotics. That's when we developed antivirals and the big pharmaceutical boom around that. What we left behind was what happens when something actually goes wrong biochemically in the human body. When molecules don't work right, when they don't align, when they don't communicate properly, they don't attach properly, what happens then? Well, that's what orthomolecular medicine does. it goes back to asking the question, what are the molecules in your system actually doing? And based upon testing, you can figure out how to design a program to treat and correct those deviations. What we found out was that those deviations have far more to do with mental health than neurotransmitters do. And so what we say is we work at the molecular and DNA level, because molecules are affecting not just your enzymes, hormones, and proteins. They're affecting literally DNA and what DNA does. So very simply, the world of orthomolecular, ortho really being the other side of medicine. But molecular meaning we're dealing with actual molecules, not larger picture pieces such as traditional physiology. So dealing with how your chemistry is moving, shifting, and problematic or normal is the key to what we do.
So what's the most common way that patients get in touch with you or get referred to you?
It's usually word of mouth. It's usually they saw us, they've gotten to us because we were referred to in a book. It's oftentimes the internet now. People are just very much Googling anything that involves their condition. So anxiety, depression, schizophrenia, bipolar disorders, ADHD, autism, Alzheimer's. Any of those considerations, people are now just kind of going to the internet, and eventually at some point in time, they find us. Sometimes it's right away. Sometimes it takes a few steps, but it's usually word of mouth or internet referrals.
And so what's the most common type of issue that is referred to you? You mentioned the mental health having far more to do with this orthomolecular level than we had suspected, even than neurotransmitters. So what kinds of referrals are most common for you to get?
I think almost any doctor would say the two biggest mental health complaints that they ever get involve anxiety and depression. And those are probably the most common themes. No matter what the mental health condition is overall, you still see anxiety and depression as some component. So I would say anxiety and depression are the most common. Bipolar and schizophrenia are also up there. Brain disorders like autism, for example, extremely big. And of course, one of my favorites, which is what got me into this field and made me a believer in this field, is schizophrenia. These are some of the most difficult constructs that we deal with in traditional medicine that we now have actual treatment for and great understanding around without using pharmaceutical drugs.
Well, that sounds a bit sketchy. Does insurance pay for the kind of treatment that you're just referring to?
No, insurance doesn't pay for it, primarily because they don't consider it to be, how we put it, founded with traditional medical evidence. So they want the double-blind studies, and they want all these things that, quite frankly, the pioneers in this field thought would simply not be appropriate to do, because it means that while you provide treatment for one group, you withhold treatment for another. And morally and ethically, Dr. Pfeiffer found that to be very challenging. So his studies were not those double-blind studies, but empirically they're all there. And everything we've seen since that point in time have actually turned out to be very true. So insurance companies, on the other hand, was very interesting. Depending on the insurance company, they can get two people, ask them for reimbursement or payment. Both of them come to the clinic, both the same day. One person gets covered 100%. The other person gets turned down flat. Same insurance company. It actually happened. It actually happened to us. So for the most part, we say it's not covered by insurance, but many insurances will cover some aspect of it, perhaps not the whole thing.
So what does a course of treatment look like? What's the initial assessment process and, your intake and assessment process to begin there?
We spend quite a bit of time with patients. So in medicine, it's very clearly understood that if you listen enough, take the time with a given patient, they will actually tell you what's wrong with them. So we spend about anywhere from an hour to an hour and a half with our patients, doctor to patient. Before that, the patients actually have an intake with a nurse, and the nurse spends anywhere from half an hour to 45 minutes with them. So we're really talking about a process that involves probably a good 2.5 hours to 3 hours of just gathering information and data before we look to do any testing. Then there's the testing process where, based upon the history that the patient has given us, we determine which labs we want to order. So we have objective evidence of any issues that are going on and support so that we understand how to target the imbalance in chemistries that will hopefully lead to improvement or resolution of the patient's condition. Once we have that information, then we put together a nutrient program. We actually hand design very specifically for each patient the actual milligram dosage, the actual nutrient that's necessary. We put together the frequency, and we put together all the combinations. We make sure that nutrients are not going to be contradictory to the person's chemistry. In other words, you get what's designed for your needs, not some general construct that's out there in some store somewhere sitting on a shelf. It's hand designed for you.
So then is the process of treatment taking a series of supplements?
Correct. I like to call them molecular targeting agents.
Okay.
Because each nutrient is geared towards shifting another molecule into its proper place. So one analogy I often use is a billiard game and a billiard table. So just about everybody's played pool at one point in time or another. So after the initial break, and I mean break, somebody becomes depressed or schizophrenic or whatever have you, the break, systems and chemistries are not moving properly. So when you see the balls on the billiard table in different places, your goal is to take your targeting agent, the cue ball, target it towards a particular ball in order to drive it in a particular direction, to get it in one of those holes. Now, if you're really good, you call out your shot. You say, okay, here's the cue ball. The sixth ball goes in the corner pocket. Well, that's pretty much what we do. We see, for example, your zinc level is low. We've got to get your zinc level to, say, 120. Here's the agent we're going to use. Now we're directing it by design to do that. So this is how we create our nutrient programs. We first see what's wrong. There's the table. And then we design a targeting mechanism to get nutrients, to get molecules to move in the right direction and increase or decrease appropriately.
So how much of it then is done in concert with recommending a whole rework of someone's diet, let's say?
Well, it's interesting, Dr. Tim. When we first started this, we didn't do anything with diet at all. Back in the days of Carl Pfeiffer and Dr. Walsh and the original Pfeiffer Treatment Center, we did not deal with diet. We had people go see a nutritionist. In fact, we had one on staff, but we didn't ourselves do it. They were consultants. The Mensah Medical method involved here. We now look at diet quite intimately, but it's diet after we've tested your chemistry. So we now know, for example, if you're an undermethylated person, you can't eat tons of dark green leafy vegetables. We know quite the opposite. If you're an overmethylated person, well, tons of dark green leafy vegetables is exactly what you need to eat. If you're a person who's toxic in copper, you need to cut down on foods like avocados or cut down on foods that are rich in copper, such as certain shellfish. So once we've tested your chemistry and we know who you are, then we can actually design a dietary program to help you achieve your goals and certainly not allow you to hurt yourself because you're eating a general diet or maybe an extreme diet in the wrong direction. So diet becomes one of the key pieces that we work with now.
Wonderful. So is there a range of cost for an assessment through treatment? For an average, you were talking about the depression and anxiety, very common diagnoses.
We actually have one set fee for the chemistry aspect of this. Okay. So our fee is generally speaking the same for everybody. So no matter what your diagnosis is, whether it's autism, whether it's anxiety, depression, whether it's schizophrenia or bipolar disorder, or maybe you've got several different disorders in play. Maybe you have a visual processing disorder as a child or an auditory processing disorder. It's all going to be the same fee. So there's no rate that changes by way of diagnosis that's presented.
So that fee you're talking about is for your assessment and diagnosis services, and then does that include the supplements that people have to take through the course of treatment?
No, we keep ourselves separate. So we don't have a compounding pharmacy that we own. What we do is we actually send a prescription to a compounding pharmacy, and they charge their own fee for those supplements. So that part is separate from us. We design it, and then we send that design for somebody to put it into production. Compared
to the fees of some of the pharmaceuticals that some of my patients are taking, and I've been witness to, the complaints about the price of these things and how they couldn't even come close to affording them if they didn't have insurance. Are the kinds of nutrition compounds that you have constructed, are they in the same kind of price range as pharmaceuticals, or are they?
No, they're generally cheaper. I mean, we tend to average what would be basically about $100 a month for your entire nutrient supply, your entire nutrient program.
All right. If you have any, I'd love to hear, I'm sure the audience would love to hear a success story or two or three.
Oh, we've got plenty. Pick a category, Dr. Tim. Let me tell you about autism, for example. One of my favorite stories, 4-year-old autistic child who had never spoken a word in life. Never spoken a word. It was 2 to 3 months after he started our nutrient program. The mother called us. I'll just be honest, they're from Michigan. I'm not giving any names, so we're not worried about any kind of security here. But she called us, and she was in tears. And we said, well, what's going on? She said, my 4-year-old just walked up to me and said, Mommy, I love you. Child did not say Dada or Mama. This 4-year-old that had never said a single word spoke a sentence to his mother that showed emotion, that showed understanding, that showed relationship, and that showed caring. She never knew her child had that. That was based upon our treatment protocol. One of my favorite stories. One of my other favorite stories, a young gentleman who has bipolar disorder. This poor fellow could hardly even manage. He's a young guy. He was in his early 20s. He could hardly deal with stress or anxiety. Hardly. He could hardly talk to anyone. 1 year after starting the program, he was actually running his parents' company.
Oh, wow.
He had a definite bipolar disorder diagnosed by traditional medicine on traditional medications. And all of a sudden, boom, he's doing so well that he was actually running his parents' company. As a matter of fact, he encouraged them to open up a second branch of the company, and he's running it all. One of our favorite issues, though, I have to talk about females and depression. They're oftentimes in the similar spectrum as females with postpartum depression. And we've had several young ladies with postpartum depression and depression do extremely well. One young lady has written a book. That book is called I See You, Copper. And she's an exemplary individual. She battled with depression for over 40 years. And after moving through our treatment protocols, she now lives a virtually depression-free life. And her life has changed so much that she actually wrote a book about it. And we just absolutely are pleased because she has done so well that she became inspired to help other women. So I've given you one in every category. We have a male, we have a child with autism, we've got a female with depression, and we've got a major psychiatric disorder called bipolar disorder, all of which have done tremendously. And that's not an exception to the rule. This is typically what we see.
So before we move past it, the title of that book is I See You, Copper?
Well, the molecular verbiage for copper, the molecular construct is a C and a U in chemistry terms. C, U. And so the book is called I See You, Copper. She had a little play on the words there.
Excellent. So what percentage of people that you get referred to you have good results through the Orthomolecular program?
Somewhere between 75 and 85% across the board.
I was doing an interview with Dr. James Kowal, who I'm pretty sure you know, who does the QEEG neurofeedback, and he was talking about results they're getting with people who have autism and other things that are without any of the side effects of the medications, and how as they work, they can work with people who are taking the medications. And as they work with people find they don't need as much medication, or people work with their doctor to actually discontinue medication. Do you find the same kind of thing with your work?
Absolutely. What we do works in parallel with people who are taking medication, so it's their choice. Some people feel very secure on their meds and they don't want to get rid of them just yet, but they want to go down to the lowest effective dosage due to side effects. So we work with that. Some individuals don't want to be on medication at all. We work with them. And some individuals say, I just want my meds on board until my nutrients are up and I can take myself off of them. And we say, that's fine, but work with your doctor to take yourself off the medication. So don't do it alone. But we have those three categories of patients that we generally work with.
So as you review, you're working out of, what's the town? Is it Warrenville?
Warrenville, Illinois, yes, just outside of Chicago.
And at that site, what kind of facilities do you have?
Our main clinic is here. LabCorp facility that we use for drawing blood and so forth is just down the street. So we're pretty well self-contained.
And who's involved in your clinic? What kind of clinicians are you working with? You've mentioned a partner, Dr. Bowman.
Dr. Bowman and I run the clinic. We are the primary practitioners here. And so when people come in, they actually see us. We're the ones who actually do the work. We have a team of nurses as well. And those nurses become their support managers, if you will, their clinical support managers. And we have 3 nurses who are the most experienced in the field. There is no training program in what we do for nurses. So we grab these folks from the same original center where we used to work. And so we've got literally the most experienced nurses on the planet in the orthomolecular field, as it was described by or put forth by Carl Pfeiffer. We also have outreach clinics, though. So our clinics in Florida, we've got 2. One is in Fort Lauderdale, and the other one is we just started this one in Tampa. We have an outreach clinic in Michigan. We have an outreach clinic in Maryland on the East Coast, Northeast Coast. We have outreach clinics in Northern and Southern California, as well as Arizona. So we literally travel to different sites throughout the course of the year to share this process and to help people who otherwise have difficulty finding help.
Now, are those outreach clinics staffed by other doctors, or are they only open when you go out to do a presentation?
Currently, they're only open when we go out to do a presentation. So we, once again, literally see patients in those areas. We are licensed in those states.
So you mentioned one out in Northern California?
That is correct.
What area of Northern California is that?
It is right outside. My geography with California is really bad, Dr. Tim, so you have to forgive me. I always have to remember Northern California is the San Francisco, so it would be Burlingame. Burlingame is where we have our clinic. Burlingame area.
Now, are the outreach clinics listed on your website?
Yes, they are. All of our locations are on the website. Addresses, how to get to them, how to contact, all that information is there.
So the primary website that I've used for your work is Mensah Medical, MENSAH, medical.com. Is that the primary website you'd have us refer people to?
Correct.
So do you often, if at all, refer your patients to other support, other professional support, for instance, Dr. Kowal or any other?
Actually, we do. So, for example, we talked about diet. We have a nutritional, I won't call her a nutritional therapist, but a nutritional expert in California whose name is Samantha Gilbert, as she pronounces it. It's spelled Samantha Gilbert. She's wonderful because she understands the chemistry and how to create a dietary regimen, including meal plans to help people with particular chemistries. But more importantly, right now, I'm glad you asked that question, Dr. Tim. One of the most important things we're doing right now is to build a bridge between traditional medicine and fields like psychology so that we can now have individuals who are trained to talk to people and to understand them, work with them as they go through the nutrient protocol, as they go through the nutrient process, to help support them and their families as people go to the road of recovery. Also, we're building bridges with social therapists and individuals who can help with some of the other challenges that people have as they move through this process. Originally, back in the old days, we just did what we did was we looked at chemistry, we put together a nutrient protocol, and that was it. People had to go out and find new ways to help with support. Now, with the Mensah Medical method or protocol, if you will, we're engaging other specialists to help with support. And so we're beginning to build bridges in other directions so that our patients can get the kind of help they really need. Not just the chemistry, but emotional support, supportive direction from therapists. Their family members can also go to these individuals to gain help. We're just now building those bridges, and we're excited because that's the kind of thing we think is really necessary. And it's not just happening in the United States. We're building these bridges globally. We've met with psychologists from around the world, and we're literally helping to bridge the gap and to build these new dynamic steps for patient and personal support.
Wonderful. What's the wait time to get in for an initial assessment at your clinic currently?
Usually it's about a few weeks. It all depends on the season, of course, and it all depends on how busy we are and if actually we're in Chicago, because we do a lot of traveling and we do a lot of speaking. So if we're not off in Australia or Ireland or somewhere along those lines, then you'll likely be seen sooner rather than later. But if we're on one of those trips where we've got to stop here and there, then it might be a bit of a longer wait. But on average, it's probably at least a few weeks to a few months.
So what's an area of your practice that, if there is one, that we haven't even touched on yet that you want to make sure we're expanding people's awareness of?
I would have to talk about our new research institute. The work that has been done before us is wonderful, but we've come to understand that there's much more applicability to what we do than just mental health. So, for example, fields like cancer, breast cancer in particular, fields continuing the work that's been done, schizophrenia, bipolar disorder, physiological challenges now, cardiac issues, kidney issues, all those types of challenges are now being researched in terms of how chemistry fits into this and how, as we manipulate and provide nutrient therapy, things may also change. That's why and how we created the Mensah Research Institute. We've got a great executive director, Mr. DJ Wells. We've got a wonderful researcher. We're looking to build and expand that model. So we're now having our first fundraiser, which is coming in. That's a totally not-for-profit institution, by the way, our research institute. So we're taking the work that has been done before us and we're expanding it tremendously. We're really looking at bridging the gap between mind and body. And most importantly, we're seeing the crossover benefits that nutrient therapy has on issues such as cardiomyopathies, on issues such as what most people would say would be fatigue or ophthalmological challenges. We're seeing even specialists in these areas using nutrients. So our goal, and one of my major passions, is to help people with cancer. We can support individuals. I'm not going to say treat, but I'm going to say we can support individuals to do better. The doctors that we've trained in the Mensah Medical method for helping to support cancer overseas have come to us and said, thank you. And I've said, why? And they said, because our patients have done extremely well. Some of them mentioned, well, we lost some. We lost one or two. And I said, I'm sorry to hear that. And they said, no, Dr. Mensah, we don't want you to be sorry because you don't understand. These people, when they passed away, they were vibrant. They had energy. They were not bedridden. They were not emaciated. They were not feeble. These were people who were dynamic. We just got to them too late. And Dr. Tim, that was one of the most impressive testimonies I've ever heard from a physician. Not a testimony to me, but a testimony to what can be done in areas where we thought we had very little capacity, like cancer. Not true anymore. Nutrient therapy can be very helpful and very supportive and provide an entire different process in conjunction with traditional approaches to cancer therapy. So that's one of the things that I'm really excited about. And that's one of the major areas the Mensah Research Institute is involved in addition to carrying on research with regard to mental health and all that's come before us. We are taking it just to the next level.
Wonderful. Well, something that hasn't been mentioned yet is the area of concussion or post-concussive syndrome. Do you have any experience applying the nutrient therapy to that?
Absolutely. Absolutely. Here we target what's called the inflammatory model or oxidative stress model. And it's one of those areas that we've been talking to individuals who are former athletes, for example, and I mean professional athletes, and working with them on helping to decrease that inflammatory process that happens after concussions, that happens after multiple head traumas. Even going way back, there's some very famous athletes that have gone through our program. And I'm not going to mention who they were, but I can tell you literally the entire world has heard of these people. So it's one of those things where it is a very real construct. There can be help for that, but we have to get that process moving, because the longer you wait, the more inflammation happens, the more challenge and detriment that patient goes through, and the harder they are to recover. But it is possible. People can do very, very well.
Just thinking as you're talking about it, would be a wonderful synergy between people like Dr. James Kowal and the QEEG neurofeedback, and Dr. Zielinski, who does functional ophthalmology. Both are seeing quite a bit of progress helping people with concussion and post-concussive syndrome. And it'd be wonderful to see the targeted nutrient therapy added to that in a team approach.
Absolutely. I think it's very important for us to all understand that when we are talking about help, it's not about us versus them. It's not about this is all you do. The question is, what does the individual person really require? How do we help? And who can we also bring into the fold as sort of a global approach to each patient? That's a model that they have at John H. Stroger County Hospital in Chicago, at Mayo Clinic, in terms of traditional medicine. We have to look at a similar model of acquiring the direct professionals to help a given patient who's got a particular issue and putting all of them together. But sometimes it's about the right time and the right sequence. So people who've got chemical imbalances often don't do as well with neurofeedback until those imbalances are corrected. And then they sit as a wonderful blank slate for that neurotherapy to do tremendous work. We often see failure or shortcomings with individuals who still have prominent chemical imbalances, who try to do things like neurofeedback and other modalities, including brain timing techniques and what's called the interactive metronome. So there's always a timing. It's not about right or wrong. It's usually where do we start? Where do we go next? There are programs that operate and develop the cerebellum that actually should be done before nutrient therapy comes on board for a given type of patient. So we're not saying it's always nutrient therapy first. Quite a bit of the time it's a good idea, but there is a specific timing for each patient. First, knowing your patient is the key, and then designing the kind of protocols and talking about which therapies, that comes second.
Wonderful. So talking about, I use the term holistic, but I believe you use the term comprehensive medical or comprehensive mental health treatment. Is there a range of specialists that you like to refer to people to make sure that the people you're working with are being supported in that comprehensive way?
Yes, and I use the term comprehensive medicine because what we are really kind of saying here is that what we've been calling mental health is really not about the mind. What we've been calling mental health is actually about the brain. The mind operates within the construct of the brain and outside the construct of the brain, by the way. So what is it that influences the mind and its capacity? Well, it's kind of like you getting in your car and driving somewhere. You are you, your car is your car, but you know what? If there's a problem with the engine and it doesn't start, you don't go anywhere. So the brain sits there, and if it's dysregulated, the mind can't function properly. So we talk about brain disorders. And so when we're talking about mental health, really what we're referring to is brain health. So we call it comprehensive because it's looking at more than just neurotransmitters, pharmaceutical agents, and the traditional stuff of traditional medicine. It's looking at the molecular model, which helps us to be more inclusive and expand all that. Now, part two to your real question. Once we're dealing with these issues, we actually can determine whether or not somebody requires a specialist that's separate and distinct from us, and then which specialist they would want to be involved with. And then quite often, because it's regional, they might have to find on their own who that specialist might be, but at least we're able to target for them which specialist they need to see, what type of specialist they need to see. So we work in synergy in that direction. And then there are, of course, the therapists who are the cognitive specialists. How do you now reshape how you approach a given situation? How do you undo past traumas? How do you undo these things now that your chemistry is normalized? Those are the kind of directives that we typically want to shape for our patients.
Wonderful. Well, thank you so much.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.